This is a metered dose inhaler, also called an MDI. Many medications used for asthma and/or COPD are delivered through this type of device. Some medications delivered in an MDI require that you prime the inhaler before first use or if you have not used it for a certain period of time. Most instructions tell you to prime 2 to 4 times. This is how to prime your inhaler. Remove the cap and press down on the canister with the inhaler pointing away from your face. Please follow your inhaler's package instructions for specific information. There are different methods for using this device, an open mouth and closed mouth method. We will now demonstrate how to use a metered dose inhaler with the closed mouth method. First, shake the MDI well to mix the medication and the propellant. Remove the mouthpiece cover. Check for and remove any dust, lint, or other objects that may be in the mouthpiece. Exhale fully. Raise the inhaler to your mouth and make a tight seal with your lips around the mouthpiece. Press firmly down on the top of the canister while you take a deep breath in slowly. After inhaling slowly and deeply, hold your breath for 10 seconds to allow the medication to move down to your lungs. You can remove the device from your mouth while holding your breath. If you need to take a second puff, you should wait about 30 seconds and repeat the process. Shake, exhale, make a tight seal around the mouthpiece, press and inhale, hold your breath. Replace the mouthpiece cap. Always check with your doctor if you have any questions about your medication or use of your inhaler. Some MDIs include counters to help you keep track of how many puffs of medication are left. For MDIs without counters, you will need to keep track of how much is used. For example, if your MDI has 200 doses and you use 2 puffs twice a day, your MDI will last 50 days. Some medications require that you rinse your mouth with water after each use. Check with your doctor if you have questions about whether or not you should rinse your mouth after using your inhaler. Inside the MDI are both the medication and a propellant. Because the propellant can clog the mouthpiece, the MDI holder should be cleaned once a week. Do this by removing the canister of medication from the plastic holder and then remove the cap from the mouthpiece. Rinse only the holder with warm water. Allow the holder to air dry on the counter, preferably overnight. Reinsert the canister in the plastic holder after it is fully dry. The MDI should be stored in a cool, dry location and not be exposed to extreme cold or heat. Please follow your inhaler's package instructions for specific information.